Hi, this is Dr. Parijat Kumar, Director of International Sports and Orthopedic Manual Therapy. Welcome to the Answers for Pelvis Assessment Lab quiz. Today's lab was a bit difficult. We understand that. We want you to learn the assessment in a proper evidence-based way. Okay, so let's keep going with the answers for today's pelvic lab quiz. The first question was, which sacroiliac ligament prevents counternutation? The answer was long dorsal ligament. It is a ligament which is attached behind the sacrum and it prevents the counter nutation. So if this is a nutation, this is the counter nutation. That ligament, long dorsal ligament, prevents the counter nutation. One thing I forgot to mention, guys, the passing score of this quiz is 7 out of 12. Yes, we have 12 questions this time. So the passing score is 7 out of 12. If you score 7 or more, then only you will get your certificates. All right. So the second question was, which of the following muscle forms the posterior sling? Yes, there are many slings to the pelvis and the sacroiliac joint. So you need to know each and every sling to know and treat the muscles. The correct answer is latissimus dorsi and the gluteus maximus through thoracolumbar fascia. So gluteus maximus and latissimus dorsi. If you don't treat these muscles, then the posterior sling of the pelvis or the sacroiliac joint is not being treated. All right. The next question is, supine to long sitting test goes from long leg to short leg. So when you're doing the supine to sit test, the leg goes from long to short when you compare with the medial malleoli. So the dysfunction is anterior innominate rotation or the anterior rotation. The correct answer is anterior rotation. Next question, the patient presents with R on L sacral dysfunction. These are osteopathic positional faults that you have to correct in order to get a proper low back pain or a pelvis assessment. So if a patient is presenting with R on L sacral dysfunction, that means that the right sacral torsion is present on the left axis. Yeah. So this is the front side. So the right sacral torsion is present on the left axis. Next question, which of the following muscles form the longitudinal sling? And the answer was quite obvious. It is your peroneus longus brevis, biceps femoris, sacrotuberous ligament, thoracodorsal ligament, and erectus spinae. Yes, guys, that is the correct answer. All right. It's a pretty long, a lot of muscles involved in those longitudinal sling. The next question is, the patient has sitting flexion. These are like case study questions. So the patient has sitting flexion, standing flexion, and Gillette test positive on the right side. Supine to sit test is like long to short. Sacral base is deep on the right side. So these are the findings that you do with your physical examination. Now you have to name the dysfunction. So if the sacral base is deep on the right, and those tests are also positive on the right, so you have to figure it out. What is the correct answer? The correct answer is L on L sacral torsion, which is called left on left sacral torsion, where your right sacral base is deep and your left ila is prominent. All right. I know these are confusing positional faults. You need to study and learn them and then understand the assessment. The next question, the patient presents with a positive right sitting flexion, right sacral base is deep, and the right inferior lateral angle is prominent. The next question, the seventh question, the patient presents with positive right sitting flexion, right sacral base is deep, and the right inferior lateral angle of the ila is prominent. What is the dysfunction? Guys, if your right side is deep and the right ila is prominent, so that means it's a unilateral sacral flexion. So the right unilateral sacral flexion, the first option, is the correct answer. The next question was very similar, that the patient presents with a positive right sitting flexion, right sacral base is now prominent. Now this is the opposite. So the right sacral base is prominent and the right ila is deep. So this is the opposite. This is the right unilateral sacral extension. You need to understand the sacral flexion and extension and the torsion so as to correct the torsions and these positional faults. The next question was, supine to long sitting test goes from short to short. What is the dysfunction? The dysfunction is actually upslip. So it's not going from short to long or long to short. It is actually going from short to short when you compare the medial malleoli. And if you find short to short, it is an upslip. The next question, which is the rarest sacral torsion that you will really not find much? And this is actually very simple, right on right. R on R, you won't find much sacral torsions like right on right. Next question was actually a bonus question from our last virtual lab on knee joint complex, which was on the dial test, where the patient suspected for the right knee instability. Dial test is performed at 30 degree or 90 degree. And what is the interpretation of the dial test? The dial test interprets the injury to both the PCL and to the posterolateral corner. So the right answer is third option in both 1 and 2. Another bonus question, which is actually from the elbow, and we are sorry to throw these questions, but we want you to learn and attend these labs so that you can assess and treat both at the same time. So the question was, what is the direction of force of the triquetrum in the ulno-triquetral manipulation? That is a treatment technique. The correct answer is dorsal. So the dorsal is the direction of manipulation force when you manipulate the ulno-triquetral joint. All right. We would welcome your feedback and suggestions, guys. Please let us know if you want us anything to improve. Technical glitches, we understand sometimes it's not in our control, so we'll try to control the technical glitches as well. But if there's anything that we can help you with, research articles or any data or any kind of a content, please let us know. All these recorded virtual labs will be posted on our website very soon. So we are not actually posting these recorded virtual labs on the YouTube channel, but they will be recorded or posted on our website. People who qualify with the score of 7 out of 12 on this quiz, they will be given the certificate within 24 to 48 hours. We would be looking for your feedback. We did this pelvis assessment lab today. I would request everybody to register and look for the pelvis treatment as well, because if you learn these assessment, please practice this, learn this, and then come and meet us next time on the next Sunday, July 19th, 2020, 7 p.m. same time, for pelvic treatment. How do you fix this? What are the manipulation techniques? What are the muscle energy techniques? Please learn these techniques, assessment, so as to treat your difficult low back pain patients. This is Dr. Parijat Kumar, Director of International Sports and Orthopedic Manual Therapy. Any question, concerns, please email us. Thank you so much.